A new state-of-the-art machine is being introduced at the Groote Schuur hospital in Cape Town. The hospital is the first public health facility in Africa to have the robotic machine. It costs nearly 40 million rand. Let's have a look.
We're coming to you from the Groote Schuur hospital, the first public sector hospital to introduce a machine that will basically change the way in which they conduct a wide range of surgeries here, a game changer in its true sense. Now I'm joined by Dr Salakazana, who's going to explain to us how Da Vinci eye machine will work on human bodies. Doctor, thank you so much for your time. Now, as we talk to you about this robot, talk to us about how it works and how it will actually change the game in as far as conducting surgeries is concerned.
Right, thanks a lot, morning to the viewers. So the robot is one of the first in the public sector in Africa. We're the first unit to actually acquire a robot in the country. So the surgeon, the robot is essentially, a form of minimal invasive surgery, which has been around. The conventional way of doing minimal invasive surgery would include laparoscopic sort of surgery, which is also done in different disciplines. The robot has three different components. The first component would be the surgeon console. We have the patient cart and the vision cart. So the patient cart is the one that's in close contact with the patient, which essentially has the arms, which then are used to place instruments that will be working through the patient depending on what surgery you're doing and where the surgery is. Looking at this cart here, we have a demonstration that if you're operating in the abdomen of a patient, then you'd make a few small incisions and insert your pots, and then you dock the robot. Docking the robot is essentially just placing it in an appropriate position depending on the surgery you're doing. And then you place your instruments, which are then controlled by the surgeon on the console.
Talk to us about the console and how important then it is for doctors to familiarize themselves with how these machines work.
So it is quite important because, I mean, the brains of the operation really are with the surgeon on the console. And that includes a lot of training, which is done through different programs, established programs, where we learn how to manipulate the handles on the console and the different sort of pedals when you're trying to manipulate the camera and the different switches to the different instruments. So you're quite right. It's quite important that we familiarize ourselves, go through extensive training, so we can be familiar with how the surgeon console actually works, because that's exactly where the operation actually happens, because most of the manipulations is through the surgeon console.
I'm interested quickly, as I conclude with you, Dr. Salakazana, how much does this cost? And are patients familiarized with this kind of machine, considering the fact that these are new equipments that are being used to change the game in hospitals? How much does it cost, and are patients familiarized with the system before they get into the surgery?
So I don't have figures on how much the robot costs. Obviously, it is a bit of an expensive equipment, and obviously equivalent to the outcomes that we get from using the robot. But the interesting thing is that the fact that we're having it in the state practice, it translates to the fact that patients actually will not be paying for it as they come to the state practice. And which is a completely a different game if you're talking about a robot being done in private. And obviously with the institution of NHI in the future, which essentially gives equal opportunity to patients, from low socioeconomic status, middle class and high class, the opportunity to have a robot done in the state practice without actually paying for it, going through the cost of paying for expensive surgery from
amazing. I'm seeing what's happening behind you, and I'm going to ask my colleague to try and zoom in and show you what the doctor there on the surgery console is currently doing. This is, of course, an illustration of how the procedure would unfold. It's amazing how technology constantly changes our environment, and certainly coming into the healthcare sector. Dr. Salakazana, I do thank you so much for your time, and I think we'll leave it there for now. When we ask the Minister of Health, well, the MEC in the province, Dr. Mbombo, to talk to us about how they actually got this for public healthcare hospital. I'll leave it there for now. For Newzroom Afrika on Channel 405, I'm Athi Mtongana in Cape Town.